Today's Good Health segment is brought to you by Sullivan County Community Hospital. Sullivan County Community Hospital offers top-notch rehabilitation services.
We see patients from birth to 100 years old. That's something I'm really proud of. Being a small community hospital, I think it's really important that we be able to offer a diverse type of services to provide the best care to our community.
Amy Pirtle is the director. After being referred from a physician, the process starts by assessing every patient's needs.
We do an evaluation, which typically is about a 60-minute session, where you see a licensed therapist and they set up your treatment plan. And what I'm really proud of, even in your follow-up treatments after that, is that typically you're going to get a 60-minute one-on-one session with a licensed therapist or a therapy assistant. And it's tailored to your needs, personalized care, and it's just really effective. I think we've been very blessed to be able to provide therapy in that manner.
Sullivan County Community Hospital is also blessed to offer a variety of services too.
Our clinicians within our department are very experienced with a wide range of diagnoses. We do primarily see orthopedic patients, so post-surgical prehab patients, which means you're preparing for a surgery, and then patients that are seeking conservative treatment where they're trying to meet their goals maybe without a surgery. Some of the therapists that have more experience with pediatrics, so they really have spent some time with continuing education and pursuing experience in that realm or that specialty of therapy. But then we also all have experience with, young adult, middle adult, and geriatric populations for sure.
Each therapist and clinician specializes in a variety of treatments as well.
2 PTs that are certified in dry needling, which is a treatment that addresses soft tissue discomfort and pain, joint conditions as well. It is a treatment that is being ordered more and more, especially we see that from our providers that refer to us from Indianapolis, I think, and it's becoming more and more prevalent among local providers as well. So it's something that our patients and providers are seeking, and we've been able to offer that too. We have 4 clinicians also that are certified in ASTEM, which is a instrument-assisted soft tissue mobilization. It's research-based, evidence-based treatment.
And Amy herself specializes in pelvic health.
So for men and women, treating incontinence issues, constipation, men after prostate surgery is a really valuable treatment as well. And that is another thing that I think has been an up-and-coming area for therapy that we've found a way to be able to provide that as well.
The department also works in occupational and speech too.
We do also offer occupational therapy and speech therapy in our rehab services department. Have 3 licensed occupational therapists that are experienced and very professional, and also have some extra credentialing. One of my OTs has done an extra stroke certification, so we do see neuro patients in PT, OT, and speech.
And ultimately, the therapists hope to prepare patients as well as help them heal.
Patients who are preparing for, say, a total joint replacement, it's nice if we can see them ahead of time because they're going to be able to do some strengthening to kind of prep for that surgery, and typically it makes their recovery a lot easier. Plus, we can kind of spend some time educating them on what to expect after the surgery. That sometimes is difficult for providers to do that just because of time. I think really with all 3 disciplines, being able to provide evidence-based care in our local setting is a huge service to our community, because without our presence here, people would be driving to Terre Haute or Vincennes, for treatment that typically is 2 to 3 days a week. It adds a lot to the community as far as community health, but also takes a lot of strain off of population when they do need to seek out therapy services.
If you have questions, they are open Monday through Friday from 8 to 5. You can call the number on the screen with the extension 2291. And you can also learn more about the Rehabilitation Department online at schosp.com/services.